Eating Your Way to a Better Back, Part 1. Hey everyone, this is Mike Erlob with another episode of Power Your Life. So it is so good to be here with you today, and I am just super excited about our topic today. I can't even tell you how excited I am because every time I think about it, it just really gets me excited. That topic is food. I'm telling you, it's food. And the reason is because I just love to eat. I love food, all different kinds of food, but eating has always been something that's been near and dear to my heart, and I just love to eat. Back in the day, when I used to be a competitive power lifter, you can actually ask any of the guys that I used to lift with, and they'll tell you, that I was known for my ability to eat. And that just was evidenced by my expanding waistline back then. And of course, I've been able to take that weight off now. But, back in those days when I had just gotten out of the Army and was in college and going to school down in Lincoln and getting into, competitive powerlifting, I really discovered that the heavier I got, the stronger I got. And with that sport, it was all about how much weight you could put up. So how much... Whoops, we lost the video or the audio. Okay, well, I hope you guys can still hear me now. But as I was saying, back in my powerlifting days, I was known for eating a lot. And, I just ate myself through any plateau, put on a little bit of weight, I'd get a little bit stronger. And the thing was, back in those days, this was back in the early 90s, like 92, 93, on through there. I didn't pay any attention to the quality of food that I was fueling my body with. I just was getting calories, and it was nothing to sit down, and I'm not kidding you, sit down and eat an entire package of Johnsonville brats. I would just sit there and watch a Husker game. Sorry, you Hawkeye fans, but that was back when the Huskers were good, and of course I've been a fan for a long time, but I would just eat an entire package of Johnsonville brats or eat like an entire Godfather's large pizza all on my own in one sitting. I would eat a lot of food. And, I didn't realize what I was doing to my body at that time. I knew I was getting bigger, I was getting stronger. Of course, my waistline I was getting heavier. I moved, my waistline gradually increased up to where it was a 42-inch pant. So, I was pushing 295 pounds almost. So it really took a toll on my body. But, I got stronger, and so I just would keep fueling myself with the calories. Well, over time, as I got injured in powerlifting, I started having, different issues with back pain, shoulder problems, knee-related problems. And the back pain was really a real problem. I had multiple back strains, some disc problems, things from the stress of lifting. And this really caused issues for me with being able to, sleep through the night, get up in the morning and not have some pain and discomfort. And, as I couldn't lift anymore, I still kept eating the same stuff. And then over time, I decided to shrink my body weight down and really fixed my diet and really got dedicated to cleaning it up and focusing on my health. And one of the things that I noticed is, as my body weight got lighter, and it was more important than body weight, but as I cleaned up my diet and I stopped eating so many brats and pizza and ice cream and so many dairy products, milk, protein powder that I would mix with milk, peanut butter, Reese's peanut butter cups, you name it. But as I cleaned up my diet and things, and I started to get healthier, one of the side effects that happened to me was my back pain started getting better. And as my back pain got better, I noticed that there was a direct correlation to the improvement in my diet. Now, the question I had is, why did my back pain get better? And I was doing other things with my back pain too. I was directly treating it by fixing some of the imbalances that I had in my body. and some of the scar tissue issues and things like that that had happened from the injuries. But I really wondered. I wondered why did the diet? What was the direct link? And so I started looking into that a lot more in depth in the last couple of years. And obviously the drop in body weight, I went from in the 290s all the way down to 200 pounds. The weight loss certainly helped by reducing the stress on my back, but it was really more than that, because I also suffered from some tendonitis issues. I had tennis elbow in my left arm. I had some tendonitis in the rotator cuff. I had some things like that. And when I really, really cleaned up my diet and really focused on what I was eating and started eating more clean, whole foods and staying away from a lot of that processed junk and staying away from the sugar and that kind of stuff, that inflammation issues like tendonitis got better. So there was no question in my mind that there is a direct link between what you're putting in your mouth, what you're fueling your body with, and what's going on internally with you in terms of your inflammation levels. And you see, it was that chronic inflammation that really was the problem. And I was fueling that chronic inflammation with the types of foods that I was eating. Now, I don't want to bore you guys here on a talk about just on inflammation, but what you do need to know is this. When you hear the term inflammation, okay, you might think about, an irritation or redness, like maybe on your foot, or like when you get your arm scratched. And, those are definitely, outward signs of inflammation, but there's a lot more to it than that. You see, your body's immune response usually results in inflammation. And so when you introduce something into your body, and or you have an injury, your body's going to send inflammatory cells to that area where the body is battling that infection or an injury. And this leads to those classic symptoms, of swelling, redness, the occasional pain. And this is absolutely normal and natural, okay? So inflammation, I want you to know, inflammation itself is not bad, all right? It is a part of the normal healing process. It's how your skin heals. It's how the internal injuries heal. It's how your body fights off an infection, okay? However, when that inflammation and the body is in control of it, it is okay. But if that inflammation becomes out of control or persists longer than it should, now we have a problem. You see, if the inflammation continues and it never disappears, and you get constant inflammation, meaning that your body is in a high state of alertness, this leads to a lot of variety of different significant health issues, including diabetes, Alzheimer's disease, heart disease, cancer, and back and joint pain, early degeneration of the joints, early arthritic wear. I mean, there are all kinds of things that happen. Now, I want you to understand that there are basically two kinds of inflammation. There's acute and chronic. So the good kind of inflammation is the acute inflammation. That happens immediately, as I mentioned before, from an injury or an infection, and it generally resolves in about 2 to 6 weeks, okay? It's a normal part of healing. As the body heals, then it settles down, goes away, and everything's back to the status quo. However, chronic inflammation can last for months or even years. And this occurs when there are other factors that allow that inflammation to persist. So you may have an injury, or you may have like a chronic illness, and there's things that you're doing that allow that chronic inflammation to persist. These things include such as poor diet, your body's changes in your hormone levels, obesity, sleep problems, smoking, stress, and there's a lot more, but those are kind of some of the big ones. Now, what I'm going to focus on today is the diet part, all right? Because the foods that you eat have a significant impact on your ability to control inflammation and heal. In fact, that is so important. That's such an important concept that I'm going to repeat that, okay? The foods that you eat have a significant impact on your ability to control inflammation and heal. This is really, really important, okay? So if there's not anything else that you remember from this talk, I want you to remember that, all right? Those foods have a direct impact on your healing ability. So, in fact, when you're not eating properly, your blood pH is going to drop. Now, when your blood pH level drops below a 7.4, your blood starts to become more acidic, all right? Now, chronic states of acidity, they are a major cause of almost every major disease and health issue on the planet, including heart attack, stroke, and cancer, okay? So, I mean, if nothing else, I really stress, take this to heart because, if you want to get rid of your back pain, eating is key. But so heart attack, stroke, and cancer, these are all preventable health concerns and diseases that can all be impacted by lifestyle change and what you eat. Some of the common symptoms of acidity include chronic pain, skin issues, hair thinning, sensitive gums and teeth, low body temperature, bloated feeling in the stomach, ulcers, acid reflux, and even depression. There are several things that cause acidity, okay? We just mentioned them earlier. I listed a lot of those things out. Things like stress and medications, too much alcohol, okay? But one of the worst causes is diet, and it is eating too much acid-forming foods, and also weakness in your muscle system will also lead to acidity. So let's talk about the foods. What are the worst acid-forming foods? I'm going to break it down for you into 3 groups, okay? So the worst acid-forming foods are sugar, dairy products, and meat, mainly beef, chicken, and pork. All right, so those 3 areas are areas that you're going to have to be really, really careful with. Now, there's also foods that contain saturated fats, sweeteners, additives, hydrogenated oils, refined foods, refined meals. All of those also induce inflammation and lower your blood pH, okay? Now, I talk to people when they go to the grocery store. Basically, think of it like this, okay? If you ever think of a grocery store, all of the good food is on the perimeter, okay? Think about it. Where is your produce? It's on the side, the perimeter. And what's in the middle? It's all the boxed food. Well, what is that? The frozen and boxed foods, which are all your processed, refined foods that have all of these things that are added to them. And those things, doesn't matter I don't care what anybody else tells you, those things are not good for you, okay? The removal of these foods that I'm talking about from your diet, or adjusting them or reducing them, is extremely effective. In fact, it has been shown that people who clean up their diet and they add more alkaline food, so these are foods which allow their blood pH to raise. Okay, so acid, your blood pH lowers, alkaline, it raises, all right? So the more alkaline you can eat, all right, they have reported feeling much healthier as quickly as 1 week. So controlling inflammation is a key to reducing chronic pain. Now, where do you start? Because, if you're like me, when I started researching this and started applying this to my life, I did this over a course of time, and it is confusing. The more resources that I looked at, the more things I read, it just seemed like, man, there's so much stuff out there. And you see, I like to keep things simple. And that's mainly because I believe that simplicity is the key to success, all right? So if something is too complicated, and this is how I approach with my clients too, if I'm working with somebody who has back pain and I make this too complicated, I make the programs too complicated, guess what? They're not going to do it, okay? So we want to keep this, as simple as possible. So here's what I recommend. If you want to speed up your recovery, and this applies definitely to back pain, but these principles, you can apply these to just being healthier. They're going to help you with tendonitis. They're going to help you with arthritic issues, any of those degenerative issues and processes orthopedically. These recommendations will reduce your risk of heart disease, reduce your risk of cancer, give you more energy and help you feel better. So if you want to speed up that recovery, you want to heal faster, here's what I recommend. The number one thing is drink only water, tea, or coffee. Okay? Now, if you drink coffee, black. Don't add anything to it, okay? Don't make it a foo-foo coffee drink. The more you add to it, now you're just adding sugar, okay? So minimal sugar, drink only water, tea, or coffee. Stay away from juices, stay away from any of those drinks that contain sugar, because you're adding not just calories, but you're making your body more acidic. You're adding that sugar to your body, okay? So that's number one. Number two, this really goes without saying, but avoid high concentrated sugar foods. Things like candy, cookies, cake, processed foods, okay? Stay away from those things. Now, if you got a little bit of a sweet tooth, kind of like I do, dark chocolate is okay, all right? So if you're gonna eat a little sweet, eat some dark chocolate, all right? Number three, avoid dairy products. Things like milk, yogurt, sour cream, all right? Now, cheese in low amounts, cheese is okay because it's fermented. It's not going to have that same effect on the body. Now, here's something very interesting, because I've had clients ask me this. I said, well, Mike, I've got osteoporosis, or there's another condition called osteopenia, and that is where your bones are getting soft because of low calcium. And I said, well, I got to have calcium. And most of us think, well, it's going to be dairy products. It's going to be, milk and yogurt, or they're eating yogurt because they want the probiotics. Well, here's what I'd say. Okay, with yogurt, if you're eating that because of the probiotics, you can take a probiotic without getting the yogurt. Okay, so you can buy a good probiotic, and I would highly recommend that, because that's really going to help you prevent the leaky gut syndrome and some of those issues digestively. Okay, that'll help maintain the good balance in what we call your microbiome. So that's really, really important. Just get yourself a good probiotic. Stay away from that yogurt. That stuff is full of sugar. All right. Now, with milk, here's the interesting thing. We drink more milk in this country. We eat more dairy products in this country than anywhere in the world. Okay? Anywhere in the world. And we have the highest rate of osteoporosis. So what I would say is, think about that. If we're taking in all this milk and all these dairy products, which in turn is actually causing us to become more acidic and making us, unhealthier, but yet our osteoporosis is still going up, there's a problem. The milk is not doing anything for building of your bones, okay? So you can take calcium supplements. You got to make sure you have vitamin D. Focus on what your doctor says. If you're taking osteoporosis medicine, do that. But if you want to heal faster and recover, you've got to get your blood pH more alkaline, and you've got to avoid those dairy products. That's really just key. This is number four. This is, again, I want to keep it simple for you, all right? When you sit down to eat, 20% of your plate should be a meat portion and 80% should be vegetables, all right? 20% meat, 80% veggies. Just follow that, 20-80 or 80-20 rule. 80% veggies, 20% meat, okay? Now, if you think about it, you go to you go eat somewhere like at the Longhorn or Outback or a steakhouse, and you get yourself, a nice ribeye. How much of that plate is covered by the ribeye? You might have a 12 or 16 ounce steak, right? And then it's covering probably 80% of that plate. And then you get a little bit of vegetables, and you get, some mashed potatoes, okay? That's really opposite of what it should be. First of all, the mashed potatoes should be off the plate. 80% of that plate should be your vegetables, and you only need a small amount of meat. Even just the size of the palm of your hand, or less than 8 ounces of meat really is all you need. And you're better off staying with leaner meats, staying with seafoods and fish and salmon and mahi and walleye and those kinds of things. You could still do some red meat and chicken and pork, but again, keep it in the 80-20. Now, what I would recommend is that you try this for 3 weeks. Just give it a try, okay? Try it for 3 weeks and see how you feel. Trust me, you can do anything for 3 weeks, all right? But give it a try, see how you feel. And I guarantee you're going to start to notice some improvements. You're going to notice some significant improvements. You're probably going to lose a little bit of weight, which is just, hey, that's just a great side effect. But more importantly is what you're going to be doing on the inside of your body to help yourself become more alkaline and be able to heal a lot faster. So at this point, what I want to do is I want to leave you with a thought-provoking quote from Max Lucado. And he said that as long as you hate your enemy A jail door is closed and a prisoner is taken. But when you try to understand and release your foe from your hatred, then the prisoner is released, and that prisoner is you. So I'll let you guys chew on that one for a while. Which, by the way, if you would like a copy of a free copy of my new ebook, The 5 Best Kept Secrets to Fast Back Pain Relief, all you have to do is just email me at mike@flex-pt.com or shoot us a Facebook message and just say, hey, I'd like the back pain ebook, and we'll get that sent out to you. There's a lot of really great information in there that I think will really, really help you guys. So until next time, power your life and keep moving forward.